Today we're going to take a deep dive into the medication Oxandrolone, also called Anavar or Oxandrin. Before we do that, quick disclaimer. This is for educational and entertainment purposes only. This should not be used to diagnose, treat, or stand in the place of medical advice. Again, this is for educational and entertainment purposes only. I'm going to break this video up into 4 parts. Part 1 is going to be about the history, the intent, and the chemical composition of Oxandrolone. Part 2 is going to be the potential benefits. Part 3 is going to be the potential drawbacks. And then lastly, part 4 is going to be about best practices, namely some of the things you can do if you are on Oxandrolone to hopefully maximize those benefits and minimize the potential drawbacks. So do me a favor, if you learn anything in this video, like the video. If you're interested in content like this, don't forget to subscribe. Now let's get into part 1, the history, intent, and chemical composition of Oxandrolone. It's important to have a basic understanding of the history and the chemical composition of this medication so that part 2, 3, and 4, the meat and potatoes of this, actually makes a lot of sense. So first and foremost, this medication was developed in the 60s by a company called Searl Labs. They wanted to do what we all want, basically get the anabolic properties of testosterone with none of the drawbacks. Unfortunately, it doesn't work that way, but they made their best attempt. It was basically in circulation to treat muscle wasting and help with recovery from certain surgeries and burns specifically. From the 60s until the late 80s, another company, pharmaceutical company, picked it up in the early 90s, and it had approval up until 2023. FDA just pulled its approval in 2023. So we have 40 years of clinical research and use to draw from. So now that we understand that this is a well-researched and studied medication, I want to talk about the chemical composition. I put together a flow chart we're going to look at together. It'd make a lot more sense for me. Hopefully it helps you too. But first, I want you to think all anabolic androgenic steroids has testosterone at the top. That's like the granddaddy, that's the top don. Everything else is a chemical alteration of that. Oxandrolone is no exception. So if we look at this flow chart, you have testosterone at the top. Testosterone can go through a metabolic process called 5-alpha reduction, and it turns into dihydrotestosterone. Dihydrotestosterone, what's unique about it is it does not convert into estrogens. So testosterone converts into estradiol via the aromatase enzyme. Dihydrotestosterone does not convert into estrogens. And as a result, Oxandrolone, which is a chemically modified form of DHT, also does not convert into estrogen. So take that with you the rest of this video. They alter dihydrotestosterone by adding an oxygen group, which makes sense, Oxandrolone, and then they methylate it. So this falls under the steroid classification C17 alpha alkylated steroid. So some other medications that fall under this would be Dianabol and Winstrol. So this methyl group allows it to be orally bioavailable, meaning that it will pass through the liver without being destroyed. So I want you to also take that with you through parts 2 through 4. This is an oral anabolic steroid that is designed to go through the first pass of the liver. Let's also just briefly talk about half-lives. Oxandrolone has a shorter half-life than a lot of other medications. For instance, we just did a video on nandrolone. Way faster than nandrolone. The half-life of Oxandrolone is 10 hours. Now that doesn't mean 2 half-lives, means it's all gone. It takes 5 or 6 half-lives for the drug to become nearly undetectable in your system. So 50 or 60 hours for this drug to be completely gone or largely gone from your system, but that doesn't mean you won't pop on a test because of metabolites and things like that. But it is a faster acting medication with a shorter half-life than some of the other drugs that we have talked about and will talk about in the future. So now that we understand it doesn't convert into estrogen, is designed to pass through the liver, and it has a short half-life, let's get into part 2, the benefits of Oxandrolone. We're going to talk a little bit about the benefits of Oxandrolone therapy, both from a clinical perspective and the bro perspective, and some of the stuff I know from guys that run other clinics. We're going to show the benefits of that, and we're going to start off by illustrating the anabolic properties while illustrating the safety profile at the same time. That's not to say that it's 100% safe, nothing is, but I think this study illustrates just how safe it can be. So this study is called 5-Year Outcomes After Oxandrolone Administration in Severely Burned Children, a randomized clinical trial of safety and efficacy. Unfortunately, these kids were burned over 30% of their body, patients aged 0 to 18, and you had your placebo group and you had your Oxandrolone group. So 70 of these kids, they gave 0.1 milligram per kilogram of body weight twice daily for 12 months. So a full year of Oxandrolone therapy. And to kind of give you an idea of what that dose would be, if you were a 200-pound man, that'd be 9 milligrams twice daily, so 18 milligrams a day. This was the conclusion. Administration of Oxandrolone improves the long-term recovery of severely burned children in height, bone mineral concentration, cardiac work, and muscle strength. The increase in bone mineral concentration is likely to occur by means of IGF-1. We talked about this in the Simorlin video. These benefits persist for up to 5 years post-burn. Another thing I want to highlight, this is right from the results. No deleterious side effects were attributed to long-term administration. Pretty incredible stuff. That being said, there are side effects. We're going to talk about that in part 3, but this illustrates that these kids actually did gain bone mineral content, muscle strength, and there wasn't obvious side effects, at least in this specific case, at this specific dose, in this specific study. That is to illustrate exactly what some of the bros in the gym say, that they can take a lot of Oxandrolone and not see a lot of side effects. They see maybe some elevation in ALT and AST, we'll talk about that later, but they can handle a fairly hefty dose of this oral anabolic steroid without a ton of side effects that maybe some other oral anabolic androgenic steroids would illustrate. Second thing I want to highlight in terms of its potential benefits is not for muscle wasting or anabolism. It's a potential off-label use that I know some guys in other clinics have done, but you need to understand first and foremost testosterone and how it relates to SHBG and free testosterone. So you have your total testosterone level, and then you have some of it is bound up with some stuff. Let's look at SHBG specifically, sex hormone binding globulin. So it binds very tightly to testosterone, and now it isn't inert forever, but it's not readily available. So I want you to think about the free testosterone as what your body can use very quickly for things like growing muscle, for things like how it impacts your brain. Now you do want some SHBG. You don't want all your testosterone to be free, so it's just in and out of your system quick, but you don't want too much because then you aren't going to get the benefits of testosterone therapy that you're expecting. So this is a study that relates, let's just read it, and then I'll talk about the bro lore surrounding it. So the study reads, the effects of Oxandrolone on the growth hormone and gonadal axis of boys with constitutional delay of growth and puberty. So they actually, this is a pretty cool study. They gave them extremely low dose Oxandrolone, and they measured things like LH, FSH, testosterone, growth hormone, SHBG. That's what we want to look at. What they found was SHBG lowered as a result of Oxandrolone therapy. That is what some guys in the gym will do, and I actually talked to a dude that runs a clinic that uses it for this purpose. So let's say he has a guy on testosterone replacement therapy. His testosterone looks good, but his free testosterone just isn't really moving. It's not in that optimal level. This guy will actually prescribe very low dose Oxandrolone several times a week, not every day. We're talking like 2.5 milligrams 3 times a week, and he'll see the free testosterone come way up. That's what a lot of like big time old school juicers will do. They'll say it makes your testosterone work better. And I can see why they say that. That's a potential benefit, but it is also a potential drawback because you do want some SHBG and you don't want your free testosterone to just be like through the roof all the time. But that is a potential off-label clinical use of Oxandrolone, and that's why bros will use it to make the testosterone work better, like I said. Now let's talk about something that is going to segue into, it's a benefit, but it's also a drawback. Oxandrolone does not aromatize. It does not convert into estradiol. Now that's good if you're somebody that doesn't want more estradiol. Let's say, here's an example. Guys that do this stuff in the gym, they use it as part of a cutting cycle. What that means is they're using it in conjunction with a calorie deficit. So they're increasing their anabolic activity with Oxandrolone, but they're not increasing their estrogens. And as a result, they're gonna retain less water. That's why people will call it a hardening agent, or it offers dry gains. And that's because you're not having that water retention some guys will get if they have their estradiol go up. So that is a benefit from it, right? You don't have to worry about gynecomastia from Oxandrolone. You don't have to worry about water retention. But as we've talked about in the past, estradiol is extremely important for men and for women. And we're going to talk about the potential drawbacks of Oxandrolone right now in part 3. Let's jump right into how this impacts the HPTA, how it impacts your testosterone, estradiol, and DHT. I put together this chart so it makes sense. Let's say you were going to take Oxandrolone only. A lot of people think that this is like the safe way to do steroids. Somehow if it's an oral, it's safer than an injection. But let's say you decided to do this. You take the Oxandrolone. It's an androgen. It's going to tell your brain androgens are present, so testosterone is going to go down. Since testosterone is going down, estradiol, which is made from the conversion of testosterone, largely from testosterone to estradiol via the aromatase enzyme, also goes down. We talked about the benefits, the cosmetic benefits of that, but chronically low estradiol has its issues as well. Number one, it's responsible for bone health, brain health, sexual function, eye health. Chronically low estradiol, definitely not healthy. I also put DHT in here. I put a plus and a minus next to that because although you have less testosterone that's converting to DHT via 5-alpha reductase, Oxandrolone itself is an androgen and it can have DHT side effects. So let's talk about that. Another potential drawback. Oxandrolone is an androgen. Now I get it. It's an extremely mild androgen, but most people are not doing these tiny little baby doses that we see in the clinical research. Most people are not doing 0.1 milligram per kilogram of body weight. They're doing 50, 60, 70, 100 milligrams a day. And as a result, that is going to have androgenic side effects. Things like hair loss. It can agonize the prostate. For women, you can start to have hirsutism, maybe growing a little facial hair. Maybe you have some deepening of the voice. Maybe you get some issues downstairs. Now, is that going to happen on a very short duration, low dose Oxandrolone cycle? Honestly, probably not. But understand that how it's done in practice can have deleterious side effects. Let's talk about the fact that it is an oral anabolic steroid. This methylation, which allows it to go through the liver and actually have an effect and not be destroyed, also stresses the liver. So yes, we've seen some studies on how there's no measurable side effects, but there's also studies that show measurable side effects. And I can say definitively, when we do blood work on people that are doing oral anabolic steroids, even Oxandrolone, we do see an elevation in ALT and AST. Just to kind of bring in a little bit of clinical evidence here, take a look at this study. It was done in 2007. They gave these guys some Oxandrolone, burn victims again, and they found that yes, it did help with muscle protein synthesis. It got them out of the hospital sooner, but this is exactly what the conclusion says. In this large prospective double-blind randomized single-center study, Oxandrolone shortened length of acute hospital stay, maintained lean body mass, improved body composition, hepatic protein synthesis, while having no adverse effects on the endocrine axis post-burn, but was associated with an increase in AST and ALT. This is again short-term duration, relatively low dose Oxandrolone, but when it's in practice, this ALT and AST has a dose-dependent effect. It does start to elevate, and ALT and AST is basically something on your CMP that's going to show liver strain. Yes, it is much less liver toxic than things like, I don't know, Anadrol or even Dianabol, but it's still not 100% safe. You can tax your liver with this. And then lastly, and this is, I want to say, shown clinically, but definitely shown in practice when we do blood work on these guys that are taking oral anabolic agents, even Oxandrolone, we do start to see some dyslipidemia. LDL is, sometimes it goes up, sometimes it doesn't move at all. But HDL does start to go down a little bit, and that also seems to be a dose-dependent effect. And again, this is, the clinical evidence is kind of mixed here. Some show that it actually can help with things like triglycerides. Evidence also shows that it lowers HDL, but based off of what I've seen personally, Oxandrolone can lower HDL. And having this dyslipidemia, low HDL, and potentially higher LDL, that can contribute, among other things, to cardiac events. I understand that's a little bit of a controversial point, but I can't find good evidence to suggest that low HDL is somehow healthy. So those are the major things you need to look out for. Number one, it's going to lower your estradiol. Number two, it is going to have an impact on your androgens, especially at a high dose done for a long period of time. Number three, it can stress the liver. Number four, it can also lead to dyslipidemia. Now that we know the benefits and what to look out for, let's get into part four, the best practices if you're going to do Oxandrolone. First, basic principle of best practices always is to use the minimal effective dose, whatever you're trying to get out of it. Let's say you're in a clinical setting. Let's say you are working with an HRT clinic that's trying to free up some of that bound testosterone. Guys that I've talked to that actually do this, they're doing like 2.5 milligrams every other day. Very, very small dose, and that does seem to increase free testosterone. If you're somebody that's doing it, let's say black market stuff, maybe you don't need 80 milligrams. Maybe you can get everything you want out of it with 20 milligrams. So that's the first principle across the board with any type of medication. You want to use the minimum dose necessary to get the benefits that you want out of this medication. Or in this case, if it's black market, we're just going to call it the drug. So now let's talk about outside of that. You're taking the minimal effective dose. How can we mitigate some of these other potential issues? Now let's look at estradiol. Let's try to alleviate that. So you have Oxandrolone. We had that chart and we showed how it lowered estradiol by lowering testosterone. Easy fix here. You want to have a good substrate for aromatase, something that's going to convert into estradiol. So we're going to do Oxandrolone plus testosterone. What's this going to do? Obviously, it's going to preserve or augment testosterone. As a result, it's going to preserve or augment estradiol based on your dose. Now, that's going to take care of that estradiol issue, but it could potentially exacerbate that DHT issue. You could just be increasing your androgen load. And if you're a guy, you could be dealing with some hair loss. Women, I don't know if finasteride has been used in women. We don't do that. But guys have that option. If you just want to decrease those potential issues of super high DHT, you're already getting that androgen from Oxandrolone. Not much you can do there. But you can prevent the conversion, a lot of the conversion of testosterone to dihydrotestosterone by taking a 5-alpha reductase inhibitor like finasteride. Now, we'll do a deep dive on that medication at a later date. That isn't without side effects, but I've been taking it since I was 27, way before I started testosterone replacement therapy, and I've maintained a lot of hair because of it. But you have that at your disposal to basically lessen that androgen load. Now let's talk about the actual liver stress. Okay, obviously minimal effective dose. We've seen very low doses not have a huge impact on liver, but let's say you need to take something a little bit higher and you're gonna get an elevation in ALT and AST. There's actually 2 supplements that I have used for some people that come to the gym and they're asking what to do, has good clinical evidence, and it actually shows itself on blood work. The first one is N-acetylcysteine, NAC. That basically allows your body to produce more glutathione, which is like the master antioxidant and can help with liver detoxification or basically help your liver stay healthy. And the second thing is called TUDCA. Pretty expensive, actually works. Some guys want to take this milk thistle, little things, they're like 15 bucks. Dude, if you're going to spend the money on Anavar, spend the money on TUDCA and NAC. Those are 2 things, 2 supplements over the counter that I can say definitively, based off of my experience at Steel Health and Hormone Center, absolutely work. Now, let's talk about dyslipidemia, namely decreasing HDL and the increase in LDL. That's probably going to happen if you're going to be doing black market underground steroid cycles, or if you have a clinic that doesn't really give a crap about your health and they're just going to prescribe whatever you want. You don't want to compound issues. You don't want to just be stacking the odds against you. So if you're going to do these things and you're going to basically take the risk, don't stack the risks. One thing that's helped me is the most popular video on this channel. It's called How I Lowered My LDL by 130 Points Without Statins. It came with a high fiber diet. So you want to have a very healthy lifestyle. You want to be doing your cardio because that can help with things like HDL. You don't want to be smoking cigarettes. You don't want to be drinking. You want to live a very healthy fitness lifestyle. If you're going to take the risk doing something like this, don't continue to stack the risk. So I hope that best practices actually does help somebody with this. Honestly, if you start to have side effects, the half-life is so short, just stop the drug. But for some people that just want to push the envelope, fine. Do it at a very low dose, live a very healthy lifestyle, take the NAC and the TUDCA, and basically if you're worried about hair loss, take finasteride. So look, that is the best practices. That's the best we can do when we're trying to manage potential side effects, but always, always, always take the lowest dose. Now let's wrap up this video. If you learned something in this video, do me a favor, like the video. If you're interested in content like this, don't forget to subscribe. Go back, you'll see a ton of stuff as it relates to nutrition, fitness, HRT, TRT, my blood work, my experience with testosterone replacement therapy, all of that is on this channel. But if you yourself are interested in the white glove approach to testosterone replacement therapy, hormone replacement therapy, medical weight loss, go on my website, steelhealthandhormonecenter.com. We're located in Pittsburgh, but we treat all over the country. Again, that's Steel Health and Hormone Center, center spelled RE.com. Fill out a contact form. We'll be in touch within 24 hours. Like the video, subscribe to the channel, and I'll see you in the next video.